Hi juniors and students, this is Dr. Cyril Benedict. Welcome to my YouTube channel PhD MEDC. Here I am to help you undergraduates to crack the subject Public Health Dentistry from exam point of view. So before jumping into the topics, let us know how to approach the subject first. There are so many things to keep in mind. To begin with, how to split and read the subject. Okay, so read it this way. So, like many other dental subjects, like how oral surgery is dealt as oral surgery and local anesthesia, like how oral medicine is oral medicine and radiology, we have to deal with public health dentistry under two sections. This is public health. The next section is dental public health. So, these are the topics under public health, and these are the topics under dental public health. So, public health has epidemiology, biostats, concepts of health and disease, planning and evaluation, water and waste managements, primary health care and health agencies around the world like WHO, Rockefeller Foundation, Red Cross Society, etc. Whereas DPH, dental public health, the major subject topic here is fluorides. So fluorides and preventive dentistry, okay, both go hand in hand together. So fluorides and preventive dentistry, then epidemiology of the three most common dental illnesses, that is DC, dental caries, periodontal diseases, and oral cancer. Next, survey procedures in dentistry, dental indices, finance, and dental auxiliaries. So, I have demarcated this because few of the topics can be probably considered as major topics and few can be considered as minor topics in each of these sections. So there is this increased probability to get most questions from these major topics. Okay, so whenever you prepare, make sure that you cover all the major topics from each of these two sections so that there is an increased probability to get more questions, be it essay or short note, from this major topics. Okay guys, now you know how to approach the subject. So what's next? While preparing for exam, what points to be included or to concentrate more? So I have arbitrarily classified these important points under these headings, and it is from my experience only, and I have arbitrarily given the term inclusion criteria for it, so that whenever in the upcoming videos or upcoming lectures, while preparing a particular chapter, when we come across certain inclusion criteria, I'll try to cite it and you can understand easily. So the inclusion criteria begins with definitions. I know you all hate definitions, but remember, definitions are best ways to start an answer with. It will definitely fetch you some good marks if you begin an answer with a synopsis and a definition followed by an author who defined it. So few of the most common examples you should not forget to prepare are definition of health, definition of epidemiology, definition of planning and evaluation, fluoridation and defluoridation, and the definitions of techniques like ART, Pittenfisher sealants, preventive resin restorations, etc. So the next is names of authors. Names of authors, for example, certain definitions could have been given by an author, certain techniques could have been given by an author, certain preparations could have been suggested by an author, certain studies could have been done by an author, certain indices are given by certain authors. So the most common names you shouldn't forget. I'll give you some few examples. Okay, most popular example. The concept of web of causation was given by McMahon and Pio. The concept of multifactorial causation as given by Pettenkofer of Munich. The technique of sodium fluoride. Okay, sodium fluoride application was given by Knudsen. The technique for application of acidylated phosphate fluoride was given by Brudivolt. The colorimetric caries activity test was given by Snyder. Salt fluoridation was advocated in Switzerland by Vespi. So these are just few of the names. There are so many author names. Okay, so whenever you read an answer, if there is an author name, just mug up it. Next, the names of places. So certain techniques or certain techniques have been developed in certain places. Okay, for example, the double pot method was developed in Nagpur. The Nalgonda technique was developed in Nagpur. The headquarters of WHO is in Geneva. The concept of primary healthcare, okay, the concept of primary healthcare was given in the year 1978 at Alma Ata. So Alma Ata. So Alma Ata is in USSR. So these are few of the names of places or proper nouns of places. You should not forget if there is any. Next, the most popular being the dates. 1931, Churchill identified fluoride as the mineral that was present in water and caused fluorosis. 1901, Mackay discovered this Colorado stain and he termed it as mottled enamel. 1934, Trindley H. Dean gave his, Dean's criteria for classification of fluorosis, that is Dean's fluorosis index. 1956, Russell gave the Russell's periodontal index. 1960, oral hygiene index. So, and 1982, WHO's CPITN index was given. So, all these are important dates. So, certain dates could have been associated with certain definitions or certain techniques or certain places. As I told you, Alma Ata conference was held in the year 1978 at USSR. The place is Alma Ata. So, these are all the dates. Now, coming to the next inclusion criteria, numbers. Numbers in the sense certain formulae, certain range, etc. For example, 1 ppm of fluoride means 1 milligram of fluoride in 1 liter of water. 1 milligram of fluoride in 1 liter of water. Next, you remember this Galligan and Vermeulen formula. Galligan and Vermeulen formula goes like this: F is equal to 0.34 by E. Okay. This formula was given by Galligan and Vermeulen to calculate the amount of fluoride in ppm to be added for optimal water fluoridation. This is based on the temperature of that particular place in Fahrenheit. Okay. Next, certainly lethal dose and safety tolerated dose. In fluoride toxicity, certainly lethal doses 32 to 64 milligram per kg body weight, whereas safety tolerated doses 8 to 16 milligram per kg body weight. Okay, so there is one more cue to it. If you multiply the numbers of safety tolerated dose by 4, you get CLD. For example, 8 fours are 32 and 16 fours are 64. So these are the most important numbers. Finally, coming to the last inclusion criteria, that is classification. To me, probably this is the most important, because in most of your questions, this could be a 5-mark question. Okay, classify epidemiological studies, classify principles of epidemiology, classify principles of primary healthcare. Okay, steps in a cohort study, steps in a case control study, classification of types of examination as given by ADA, types of supervision given by ADA. Okay, all these things that has certain points as its answer, certain steps as an answer, all these things come under classification. I'll give you a few examples so that you can remember what comes in it. You remember this changing concepts of health: biomedical concept, ecological concept, psychosocial concept, and holistic concepts. There are four in it. You should not write anything more than 4. You should not write anything less than 4. So identify those questions in the entire subject that has certain points like this. If you read it, you'll definitely will be able to answer part of an essay or even a complete 5-mark question. So changing concepts of health, changing concepts of primary health. Next is Types of groups: primary group, secondary group, reference group, etc. There is one another classification of group, that is formal group and informal group. Next, classification of epidemiological studies: observational study and experimental studies. Okay, so hope you got it. What I wanted to convey is, if you are going to include all these kind of subheadings or points in your answer, chances of you getting higher marks will be higher, because almost all of this would be there in the key for the answer for the questions that you're going to answer. So whenever you're going to prepare, whenever you come across certain things like this, specially mark it, and whenever you're trying to attempt it on paper, do not forget this alone. That's it, guys. Hope this video was helpful to you. Let it help you in your journey of preparation. Keep in touch for more videos and more lectures from me. Remember, it's not the perfect timing, it's about your first step. Thank you and happy preparation.